Don't have very much for you today, but I do want to, once again, I can't say enough about my staff, my general managers, Merrick, during this long marathon of an emergency. Getting our facilities opened up, not all of them, but most of them soon here, and some of them, the FLC yesterday. It was really a huge feat to done. I know a lot of people just think you put some water in a pool and turn on the lights, but there's a lot more to than that, and so I can't thank my staff enough. I'm encouraging everybody to go to My Medicine Hat. We're doing promotions on the tourism website and try to follow along for the promotion per week if you're looking for things to do here in Medicine Hat, the staycation type stuff. And when it comes to these press conferences, we will do one again July 21st, I think, after the next council meeting, but then after that, we'll probably not do one until after the council meeting in August, which is in the third week of August. But we may be calling one. We have perhaps a very interesting announcement to be making next week, and so we may have some interesting information for you early next week. So stay tuned. Not specifically COVID related, but kind of COVID related. So with that, I will pass it on to Merrick. And once again, please stay safe. This isn't over yet, and as everybody knows, cases are now rising again, so we have to still stay vigilant. Thank you.
Exciting times. I mean, we continue to open up city facilities. So stage 2 was announced a number of weeks ago, and so we're continuously opening up city facilities. So I just wanted to provide a little bit of an update on that. So as Mayor Clugston had said, we opened up the portion of the Family Leisure Centre yesterday. So this includes the ice rink and the fitness area. City Hall, as I had announced in Open Council last night, and there's going to be a news release that's issued here very shortly, if it hasn't already been, regarding the City Hall. So we're planning on opening July 13th, so that's next Monday. And then the remainder of the areas within the Family Leisure Centre and other outdoor pools will be in the coming weeks. And so I just wanted to mention that things will look different. We can't expect that things are going to look the same as they were 6 months ago. Quite a bit different when it comes down to the pool areas and some other areas within the recreation world. But even in City Hall, I mean, we're going to have different things like physical distancing requirements. We're going to have barriers in place, and we're also going to have some areas that are simply restricted for public access. And I had mentioned this yesterday in Open Council. I mean, public was typically allowed on the 3rd floor within City Hall, so that's going to be a restricted area, so it's staff only. So that's just one example of restricted access. No different than there are some areas within the Family Leisure Centre, and even when it comes down to the outdoor pools, where there will be restricted areas. And so just wanted to provide an update on that. Another item that I wanted to provide an update on is just a very, very, I guess, general message here. And I mentioned this, and I'm quite passionate about this. I mentioned this at Open Council last night, is as a municipality and as a public face within this whole process, is we're still very much cautious. And so, you know, as much as we're very excited to open these facilities, is there are still a number of controls that are in place, and I'll give a couple of examples here as to why we're still cautious. Is Medicine Hat, as of yesterday, within our geographical boundaries, is we've now experiencing 10 active cases within the city, so 10 active COVID cases. And I actually can't recall the last time we had 10 active cases. And a lot of this is really coming from social gatherings, and this is publicly available information. So if you go onto the province of Alberta's website, the majority of the outbreaks that we're seeing right now, very different from what we saw, say, 3 months ago, where the outbreaks were, healthcare facilities or long-term care facilities. The majority of the outbreaks that we're actually seeing now are social gatherings. And so, unfortunately, as a province, not so much as a city, but as a province, we're seeing a little bit of complacency. And so we really need to pull back from that complacency and start thinking about some of the things that we're all so familiar with and comfortable with, is the physical distancing, the hand washing, the staying home when you're sick. I think I've said this time and time again, and people are probably very sick of me saying this, but I will say those controls work. They work very well. The majority of if you're to look at the news articles throughout North America, is the majority of all of these outbreaks and these cases are coming from these social gatherings where these controls are not being used. So therefore, you can put two and two together with this, and these controls do work. Use them. And so that's where we need to get away from the complacency and go back to the way that we were using before, because we were maintaining that steady number. A controllable case count is really what it is. Some other interesting statistics that I wanted to provide is, age groups. And so we tend to think about the majority of the individuals, specifically within age groups that are actually being infected by COVID-19 are a little bit older, and that's very much not the case. The age group where we're seeing the most infections is actually the age 20 to 29. And so I want to remind those individuals, so the age group 20 to 29, of course this is province-wide, is you may not think that you're going to get sick, and you may not think that you're going to be overtly impacted by this. That may be the case, however, you have to actually look at who you might be actually infecting with this. You may brush it off, but you have to think about your parents, you have to think about your grandparents, because those are the ones that are actually really going to get affected by it. And so we have to respect each other. So I think Mayor Clugston has said many times we have the two ends of the spectrum there, where we have some individuals that think this is a hoax, and the other end of the spectrum where it's the world is ending. I mean, we have to respect everybody on that spectrum. And so it really comes down to respect and getting rid of that complacency. And I'll come back to something also that I've said time and time again. And I want to thank the community members that are actively practicing this, is that responsible decision making. Going back to some of the city facilities that we're opening, we can put all of these controls in place, but a big control, and probably the biggest control that we can reiterate, is just the actions and behaviors of everybody within the community. As that is what is going to get us out of this, is the actions from everybody else, is staying home when you're sick. Hand washing, physical distancing, all of these requirements. We can put all these controls in place, but it really comes down to the individuals. So I wanted to really reiterate that and leave off by once again saying thank you very much to all members of the community that are really taking this to heart and really practicing some of these items. And I'll open up to questions based on that. Yeah, so the question was, speaking about City Hall opening and what are some of the controls that are going to be in place. So specifically, so when you actually come into City Hall, you're only going to be allowed to come into the one door, which is actually the door on First Street. And so the other door that will be closed, it's still closed, so you'll have to enter through the door on First Street. You'll be met with Friendly Face, which is going to be one of our commissionaires, and they're going to be your wayfinder, we'll call them. So they'll greet you, they'll ask you what type of business you want to do, and then they'll direct you to a specific area. With that, they're going to ask you for your name and a phone number, and that's really based on contact tracing, and we're supporting Alberta Health Services with that initiative. And so when you do actually go do business with the city and you go up to whether it be a customer service representative or a representative with our planning and development department, there's going to be barriers. No different than what you've seen when you go to the grocery store, hardware store for that matter, there will be barriers in place. There will also be physical distancing requirements, so there's going to be actually spots on the floor where you can stand, where you can wait in line. There's also going to be counting of individuals that are on each floor, and so we're restricting or limiting occupancy based on each floor. So there's only obviously going to be 2 floors that are going to be accessible to the public, but those are some examples in which some of the controls that you'll see. So like I said, things are going to look different. It's going to feel a little bit different, but at the same time, If you don't want to come into City Hall, that's okay. In fact, we're still encouraging people not to necessarily come into City Hall if you don't have to, because there's still other ways to do business with the city. So all of the items that we've had over the past 3-4 months here with City Hall being closed, all of those things are still going to continue. And so I really want to encourage some of those, I guess, alternative methods so that service can still continue, obviously. Yeah, so the question was, what are those occupancy limits going to be for each floor, and why next week? And I'll start with the second question, is why next week? That's when we felt that we were confident to be able to go through and actually open it up. And we took our time with this, and I'm not going to beat around the bush with that one. Is we could have opened up very quickly, but we wanted to do this right. We had our executives walk through the building. We had our health and safety team and our professionals walk through, our facility management people walk through, and really came together and built this upon it so that we could all feel confident and comfortable with it. Our staff that work here, we walk through all the processes, all of the controls with them, and so that takes time. And so we wanted to ensure that we were doing things right, number one, for our own staff, and number two, for the public. So the second question was occupancy limits, and so we're looking at 10 per floor. And so our commissioners will basically monitor the occupancy for that. Now, recognizing that we have various areas within City Hall that you can do business, and so that's why we're segregating some of those areas, so it's not simply just limiting the building occupancy limit. And keep in mind that number was really derived from the ability to maintain that 2 meters of physical distancing. So it actually has nothing to do with the mass gathering limitations set out by the province. So we actually took a look at the floor plan and we said, okay, how can we safely maintain 2 meters of physical distancing? And so that's how we actually came up with that number. So the question was, will residents be required to wear masks either in City Hall or in any other city facilities? And at this point, we're not requiring the residents to wear a mask. However, that being said, if you feel comfortable, more comfortable wearing a mask, we encourage you to do that. And in fact, we do have all of our staff have masks so that if they feel uncomfortable dealing with the public, they can wear a mask as well, or vice versa, ask the other individual to wear a mask if they feel so too. And so there's some we do have masks available for our staff here, and we obviously encourage mask use for the public, but not requiring it. Yeah, so the question was, with regards to other facilities, what are some of the timelines, such as Crestwood Pool? And Crestwood Pool is actually a really unique one, given the fact that it's an indoor pool. And so our real driver for this one, given the fact that it's summer and it's nice out, is to open up the outdoor pools. And so we're really putting a push on the outdoor pools, and so that'll be in the coming weeks, and there will be a news release issued for that so that we can ensure that we have a set date. This takes into account a couple of different things. So obviously that we're comfortable opening up, but also that the pools are mechanically sound. And so they've been empty for quite some time. And so as we fill them, we might find issues. And so we don't want to initially issue a date and suddenly find out that there's been a mechanical breakdown and have to pull back on that. So we want to make sure things are working and then actually release that date. But as it relates to Crestwood Pool, that'll be later on, given the fact that it's an indoor pool and we really know how people enjoy the outdoor pools during the summer. Yeah, so the question was, I had mentioned something that's called the COVID monitor at Open Council last night, and just asked if I could explain a little bit more on that. And that the COVID monitor actually comes right out of the sector-specific guidelines as issued by Alberta Health for pools. And so with our recreational facilities, specifically pools, we're required to have something else called a COVID monitor. This is an individual that their sole responsibility is really to maintain and advise people to maintain the 2 meters of physical distancing. So if you think about a pool, in the waters, sometimes you can forget about the 2 meters of physical distancing, and so that the individual is there to remind the people to maintain that 2 meters of physical distancing. Another interesting item with this one is it can't be a lifeguard. And it's logical because the lifeguard has other responsibilities. They're there to monitor something other than the 2 meters of physical distancing. And so that COVID monitor is simply to monitor the the controls that are in place specifically to COVID. The question was, given last week when we were sitting at, I guess high flow rates within the South Saskatchewan River, what are we sitting at now as it relates to flow rates, and what do we expect to see given the fact that it's July in the coming weeks here? And so it's interesting because last week we were sitting at, last Friday actually, that is close to 1,200 cubic meters per second, and that was a result of some pretty intense precipitation in what we call the Old Man River Basin. So this is right around Waterton, Lethbridge, that area, and so it flows down the Old Man River and towards us. And so it is the highest flow rate that we've seen in over 3 years, actually. And so we're currently sitting at 671 cubic meters per second, so basically dropped close to half by now. Even though a snowpack is near zero, I don't want to say it's at zero. In fact, it's never at zero, really, in the mountain ranges. We're still not out of this. And typically in June, we can usually confidently say that the risk is low to the point where we don't have to worry about it. But this year's a little bit of an anomaly. The reason why it's a bit of an anomaly is we're seeing some fairly volatile weather patterns. And so typically when you start looking at flow rates on an annual basis, so roughly March to anywhere between September, October, is you see a nice curve in flow rates with that peak right around in the end of June. And so we saw very much peaks and valleys this year with flow rates, and that's based on the volatility of the weather this year. And so I still can't confidently say that there's no risk given this volatility, and so there's still some monitoring to do with this. I mean, typically we at that high average point, we should be sitting at about 500 cubic meters per second right now. We're sitting at 671. So flow rates are decreasing, and in fact they're decreasing upstream, but we're not letting our guard down yet. Yeah, the question was, should recreational activities on the river still be curtailed? Absolutely. 671 cubic meters per second, you get a pretty fast river on that one. And in fact, with those flow rates, you get quite a bit of debris coming down the river as well. And so when you start looking at watercraft use, debris and watercraft use don't mix well together, especially when you have high flow rates as well. So still advising to stay off the river.